Want to get accurate and timely blood lead test results for your patients? Follow along as we share some tips with you for submitting blood lead specimens to the State Public Health Laboratory, also called SPHL or the State Lab. The State Lab performs over 3,000 lead tests per month. Approximately 2% of these are rejected for various reasons. Even more cannot be tested immediately due to issues that require the lab staff to telephone you first to resolve. That costs you and the state precious resources and time, but more importantly, it delays patients getting results and into treatment. We'll provide you with all the tools you need to make sure that specimens you are submitting are tested. The best part? It's easy. Here at the State Lab, we are proud to offer high-quality and reliable testing for your patients. We continuously update and improve our services to provide you, our partners, with the results you need in a timely manner. Our ability to do this, however, relies on you following standard protocols for collection and submission of specimens. You should have received a few protocol documents when you were onboarded to the State Lab. There are 2 methods for collecting blood lead specimens. These are fingerstick blood specimens collected in EDTA, capillary tubes, or venous whole blood samples in tan or royal blue tubes. Make sure to follow the instructions for sample collection for lead testing sent to you by the State Lab. Test tubes have an expiration date, and the Childhood Lead Screening Lab cannot test specimens submitted in expired tubes. Check the specimen tubes carefully. If you can't confirm the expiration date, the tubes should be discarded. Names and dates of birth, also known as the DOB, submitted on test kits and the submission forms must match exactly. The name recorded on both must be the same as the patient's name on their insurance card. If there is a mismatch, the testing could be delayed or rejected. That's not all. Specimen containers received without a full patient name and date of birth, DOB, or medical record number, MRN, will be rejected. Specimen labels must contain at least 2 unique identifiers. Don't forget, the Childhood Lead Screening Specimen Submission form must be completed in full and submitted with the blood specimen. The most efficient way to receive results is through the Electronic Laboratory Record, or ELR portal. Make sure that you have access to ELR by contacting elr.support@mass.gov prior to submitting specimens. Remember, the right amount of blood should be submitted. Fill the containers about 3/4 full, not too little or not too much. This will protect you and the laboratorians from hazardous spills and will make sure that the specimen has the proper blood to EDTA ratio, ensuring accurate test results. Make sure to mix specimens with anticoagulant by inverting tubes or turning fingerstick capillaries. Once filled, seal the capillary tip with the small cap. Keep the large opening sealed with the large cap attached. Do not seal the cap with clear or office tape. Specimens must be packaged and labeled correctly when being submitted. All blood lead specimens sent to the State Lab through the U.S. Post or commercial carriers must comply with shipping regulations for exempt human specimens, non-regulated materials. To meet regulations, individual specimens must be triple packaged with a primary labeled receptacle, fingerstick or venous tube, secondary container or biohazard transport bag, with just enough absorbent material, and a tertiary rigid outer shipping container or cardboard box. The submission form and other paperwork should be folded and placed in the outer pouch of the specimen transport bag. Do not use transparent or office tape to affix the specimen to the requisition. Without the submission form, we cannot communicate the results to providers, and the specimens may not be tested. Acceptable packaging follows all of these protocols. A single specimen with a printed label per biohazard bag. Specimens are shipped in primary, secondary, and tertiary containers. The submission form is placed in the outside pocket, and enough absorbent material is included. Here are some examples of specimen shipments that would be delayed or rejected. Soft padded envelope used for tertiary packaging. It's likely the specimen would be damaged during transport. Submission form with a capillary tube taped to it. Not only is it missing secondary container and absorbent materials, but the tape is covering submission information. Unclear information on tube. In this case, it's handwritten, and the lab needs to call to confirm what is written. Multiple forms rolled up around tubes in one tertiary container, with no secondary biohazard bag and no absorbent material to contain spills. All specimens should be sent to Specimen Triage Accessioning and Receipt, or STAR Lab, at the state lab where they are sorted and sent to the testing lab. Time matters. Specimens must be received by the lab within 7 days of being collected. Specimens must be refrigerated until they are transported. Short turnaround time or STAT specimens should be clearly marked. If received by 3 p.m., STAT specimens will be tested and reported the same day. Now you know what it takes to properly submit specimens to the State Public Health Lab. Follow all laboratory protocols. Check test kit expiration date. Ensure names and dates of birth on specimens and forms match. Fill specimen kits to 3/4 and make sure to mix with anticoagulant. Package and ship the specimen correctly. Send specimens so that they are received within 7 days of being collected. Together, let's make sure we are submitting specimens properly so that the State Public Health Lab can test accurately and providers can get their laboratory results quickly and patients can receive treatment in a timely manner. If you have questions or need more information regarding testing or for questions about results, please call Laboratory Client Services at 6179836665. You can access specimen submission forms on mass.gov or use the QR code. Specimen collection fingerstick capillary tubes, submission forms, biohazard specimen transport bags, and outer pre-printed cartons are available, free of charge by calling 617-983-6640 or email masphl specimen kit orders at mass.gov or use the QR code to generate an email. Thanks for watching.